Let me ask you a question. Which one of these two wheels do you think is going to roll better? Well, obviously the round one, right? And why is that? Because structure dictates function. And people get that when they're looking at an image like this, but for some strange reason, this concept is completely lost when we begin talking about the human body. You know, it never ceases to amaze me the amount of people that walk into my clinic complaining of chronic neck problems, talking about all the different doctors and physical therapists and chiropractors and massage therapists that they've been to see, and the problem just won't go away, and yet there is a glaring structural problem that's preventing their neck from functioning properly. And so this week, we're going over 5 simple ways to determine if you've got an underlying structural issue that's causing or contributing to your neck pain and stiffness. Let's get into this. When searching for clues that could point to a structural problem in the neck, the best place to start is probably the most obvious one, and that is by analyzing your physical structure. So what you're going to do here is have somebody take a picture of you directly from the side, hopefully when you're not paying attention. You're then going to take that picture and draw 2 vertical lines on it. The first is going to start at the hole of your ear and extend straight downward towards the floor, and the second is going to start here in the skin just above your upper lip and below your nose, and again extend straight down towards the floor. What you're looking for on that first line is for the line that starts in the hole of the ear to pass downward through the center point of the shoulder, which would be a strong indication that you have a normal amount of curve in your cervical spine. However, with the most common form of structural dysfunction in the neck, which is a forward head position, what you're going to see is that that vertical line will be dropping downward well out in front of the shoulder, which is a strong indication that you've lost some of the curve in your neck. And with that second line, what we're looking for is for it to pass straight downward from the maxilla and come into contact or be in close proximity to the point of the chin, just like that. What we know from biomechanical research is that the further a head pushes forward out in front of the gravity line, the more the bottom jaw will retract, leading to an overbite. And if somebody has more of a military neck, where they've lost the curve but it's led to a straightening of the spine, what we often see in those instances is an underbite. The next place to look for clues about a potential structural problem in the neck are the muscles here at the base of the cervical spine. They're called the upper trapezius. And what you're going to see here, though subtle, is super easy to spot once you know what to look for, and that is a thickening, hyperdevelopment, and change of shape of those upper trapezius muscles. And what you'll spot initially is that something seems out of place. The muscles there at the base of the neck will be bulky and developed in a way that is way out of proportion to other muscles in that person's upper body. In other words, they're going to have the neck of a weightlifter despite the fact that none of the other muscles in their body look like they've ever lifted a weight. This is particularly easy to see in a person who is smaller framed or petite. The reason that this happens is because the further the head pushes out in front of the body, the heavier it becomes and the more demand is placed on those muscles that are responsible for holding the head up. Over time, just like putting demand on muscles lifting weights, the muscles grow bigger to deal with that demand. But unlike lifting weights, which you do for maybe a few hours a week and then you rest those muscles the rest of the time, those muscles are under constant tension. And so if you go up to people who have those hyperdeveloped traps and you even lightly push on them, they will wince and pull away and usually be in pain just from light pressure. And the change of shape that I'm referring to is that a normal trapezius should have the shape, when looked at from the side, of Half Dome in Yosemite, where there is a flat-faced front and then a dome-shaped structure on the back. But when a person has those thick, hyperdeveloped traps from being in forward head position, it will be a fully formed dome that is round on the front and the back. Here's a patient that came into my clinic with exactly this structural problem. In 2010, this study was published in the journal World Neurosurgery, and these researchers did a photographic analysis of the upper trapezius muscles in a bunch of people who were going to be having neck surgery. And they compared these photographs to these folks' imaging studies both before and after surgery, and what they found was a direct correlation between upper trapezius muscles that were thick, overdeveloped, super tight, and tender to the touch, and a cervical kyphosis, which is a reverse curve in the neck, which is directly associated with a severe forward head position. Now, the correlation was so strong in this study that these researchers proposed that upper trapezius muscles that were in this state could actually be used by clinicians as a reliable predictor of a reverse curve in the neck. And they termed this cervical kyphosis trapezius sign. And the conclusion from this study was that resolving cervical kyphosis trapezius sign was associated with a high rate of pain relief. The third place to look for clues about a possible structural problem in the neck is the most obvious of the bunch, and that's the formation of a bump here at the base of the neck or excessive rounding in the upper back that looks like that. That's called a hyperkyphosis, and recently people have taken to calling this neck hump, which I don't have a problem with, except that some of these people are putting forward the idea that the body lays down fat in this region to quote-unquote protect the spine in response to that forward head shift. Now, this is complete nonsense. There's no research anywhere to suggest that that happens, and under normal physiological circumstances, the body lays down fat in a fairly even distribution throughout your body. If the body starts laying down concentrated fat in one region here that leads to the formation of a buffalo hump, this is usually related to something called Cushing's syndrome, which is a completely different issue that has nothing to do with your posture. Now, I've got a whole video that talks about the differences between a dowager's hump, forward head position, and Cushing's syndrome, and if you're interested in that, you can click the link in the upper right-hand corner to see that now. For the vast majority of folks that have a bump forming here at the base of their neck or excessive rounding in their back, the explanation is very simple. Remember, the head becomes heavier the further it shifts forward. This means that the body's center of gravity is being altered, and the brain literally feels like you're going to fall on your face. When this goes on for a long enough period of time, the body will intelligently begin shifting the middle back backward to compensate for the head being shifted forward. It's an attempt to bring the center of gravity backward to make you feel safe and secure and help ensure that you don't fall on your face. The next place we're going to look for clues about a potential structural problem in the neck may be the most important of all of these, and that is functionality. And what we're looking at here specifically is range of motion in the neck. You see, when the normal neck curve is present, it means that all of the little individual joints in the neck are aligned, which allow those joints to move through their full range of motion. The other thing that happens when the normal curve is present is that the head is held up with a minimum of muscular effort. But when you start losing that curve and the head starts shifting forward out of its normal alignment, the little individual joints in the neck become decentrated, meaning you don't have optimal contact between the joint surface above and the joint surface below, which can restrict range of motion. The other thing that happens, like we've already said in this video, is the head becomes heavier the further it shifts forward, which means that the muscles that attach to the head have to tighten up and work harder to hold that heavier head up. And that too can restrict your range of motion. And there is an established norm for range of motion in the neck. And what it looks like is this. You should have 40 to 45 degrees of left lateral flexion. You should have 40 to 45 degrees of right lateral flexion. You should have 80 to 90 degrees of left rotation and 80 to 90 degrees of right rotation. You should have 60 degrees of extension and 50 degrees of flexion. All the side-to-side motion should be symmetrical, and all of the motion should be completely and 100% pain-free. And the fifth and final clue that could be pointing to a structural problem in your neck is the presence of symptoms. And what I'm talking about here specifically is neck stiffness, neck pain, upper back pain, shoulder pain, jaw pain, face pain, and headaches. And it's hard for me to believe that this is controversial in any way, but there is a small handful of people out there who like to deny the association between posture and pain. And if the logical points that I've presented so far in this video aren't enough to convince you, here's what the research has to say. This systematic review and meta-analysis from 2019 examined the relationship between forward head posture and neck pain. The researchers here looked at a total of 15 cross-sectional studies, and after poring over all of this data, they concluded that forward head posture is significantly correlated with measures of neck pain in both adults and older adults. 1 year later, this systematic review and meta-analysis was published in the journal Pain Medicine, and these researchers looked at the relationship between chronic headaches and forward head posture. Now, overall, there were 12 different studies that were selected for this qualitative analysis, and the conclusion after going through all these studies was that there is moderate to strong evidence that patients with chronic headaches have greater forward head position than people who don't have any symptoms, and that there is moderate evidence that people with chronic headaches have greater forward head posture than those who only suffer with headaches occasionally. If you find yourself going through this video and you're checking the boxes for some of the postural issues that we talked about, you've got restricted range of motion in your neck, and on top of that, you've got some of the symptoms that we just discussed, well, then you've got to see the video that I just put out about one of the most common structural problems in the world, what it is, and most importantly, how to fix it. I'm going to put a link for that video in the upper right-hand corner of your screen. I'll also put a link for it in the description down below. Beyond that, I just want to thank you so much for watching. Make sure to hit that thumbs up button before you head out of here, and I'll see you next time.